Hi, Tom from CoverRight.com here again. Today we're going to do a session on 6 mistakes to avoid when you're selecting a new Medicare Advantage plan. Medicare Advantage plans are becoming more and more popular for a lot of reasons, and there are some really great plans out there. But there are some things that you need to keep in mind when you're selecting a plan and some mistakes that you really want to try and avoid. The first mistake to avoid is don't pick a Medicare Advantage plan just because your friends or your co-workers have told you that they're on the same plan and they think the plan's really good. That might be a great plan, but something as simple as if you need to take a specific prescription drug or a couple of prescription drugs that are different to the needs that they have for their drugs, can make a really big difference in the cost of that particular plan to you. So it's really important that you don't just take the advice of your friends and co-workers, but independently assess the plans that are available to you to see if they make sense for you. The second mistake to avoid is misunderstanding the difference between network providers in an HMO versus a PPO plan. So these are the two most common types of Medicare Advantage plans. And if you select an HMO when you should be on a PPO, it can result in difficulty in accessing the services that you need. So as a quick recap, an HMO or Health Maintenance Organization plan uses a network of healthcare providers to provide you with healthcare services. Under this type of plan, you need to select a primary care physician who you usually need to get referrals from in order to see a specialist. So although an HMO plan is slightly more restrictive in that you need to use the plan's network, typically the costs are lower as well. In a PPO plan, on the other hand, you have the flexibility to see doctors and providers outside of that plan's network. You typically don't need to elect a primary care physician and you don't need a referral to see specialists. This extra flexibility works well for people who travel often around the country. The third mistake to avoid is not correctly checking to make sure that your prescription drug needs are covered by your Medicare Advantage plan. And this can be a really big mistake because if you choose a plan that doesn't appropriately cover your prescription drugs, the extra costs that you'll pay can run into the hundreds, if not thousands of dollars each year. So what you should always do is check the plan's formulary, which is a list of drugs that the plan covers, to make sure that your prescription drugs are covered. What can also make a difference is the plan's cost share, so that's the co-pays or co-insurance that you pay for each prescription drug. And in each plan, prescription drugs are categorized according to different tiers. So you should always check the drug's formulary and co-pays and co-insurance to assess which plan is best for you. The fourth mistake is thinking that you can enroll in a separate prescription drug plan in addition to your Medicare Advantage plan. If you've enrolled in a Medicare Advantage plan, you have to use that plan's inbuilt prescription drug coverage to get coverage for your prescription drugs. If you choose to enroll in a separate standalone prescription drug plan after you're already enrolled in your Medicare Advantage plan, you'll be automatically disenrolled from your Medicare Advantage plan. The fifth mistake that we actually see a lot of is a fear that you can't find or enroll in a new Medicare Advantage plan because of an underlying health condition. We speak with a lot of people that are worried about this, that don't think that they can change plans or find a new plan because they have a health condition or have had a health condition in the past. In fact, under government regulation, Medicare Advantage plans can't deny you coverage for a new plan as long as you are eligible to enroll in a Medicare Advantage plan and are currently in an enrollment window. Medicare Supplement or Medigap plans, on the other hand, can deny you coverage if you are outside a guaranteed issue period. And if you've had health conditions in the past, it can make it more difficult to enroll in a Medicare Supplement plan for this reason. The sixth mistake is worrying that by using a lot of healthcare services, you'll impact the price that you pay for a plan from one year to the next. And this is never true for Medicare Advantage plans. All Medicare Advantage plans are paid a set amount by the government to provide your healthcare coverage. And so you don't have to worry that by using healthcare services, you become more costly to the plan because the plan is paid by the US government. All Medicare Advantage plans have a regulated maximum out-of-pocket cost that they can charge you each year. In 2021, the maximum out-of-pocket that you can pay for in-network services in a Medicare Advantage plan is $7,550. A lot of Medicare Advantage plans also have a $0 premium. And as the Medicare Advantage market gets bigger and bigger, there are more and more plans offering $0 monthly premiums. Overall, there's lots of great reasons to enroll in a Medicare Advantage plan, including bundled prescription drug coverage and those extra benefits like dental, vision, and hearing services that a lot of plans include. You just need to make sure that you avoid the key mistakes that we've been through in this video today. And if you can watch out for those, we're confident that you'll find a Medicare Advantage plan that will work really well for you. Thanks very much for watching our video today. Please like and subscribe if you have enjoyed this video. And as always, if you have any questions or comments or you want to talk about your Medicare options, feel free to reach out to us. You can find our contact details pasted below the video. We're happy if you want to email us, or feel free to call us, or you can text us as well. Thanks again for watching, and we'll be back again with another short video next week.